direction. But for a lot of people, I think they're having different issues with their legs and hip structure that's all wrapped around their lumbar spine. It's causing a problem. Is that funny to you?
No, you hit a spot there where I was like, wee.
Oh. You were just giving me this look, and I was like, what's going on? Did I miss something?
No, it was just like a brief moment of like intensity that was totally manageable.
Yeah.
Just made me smile.
This to me isn't what I consider like an advanced move, but I do think that this is really potent work when you're dealing with somebody having low back pain. This is also making the best use of your legs and feet to be able to take pressure off of your hands, which if you're part of a couple working at home and your partner is a big burly guy or something like that, then it would be easier for you to learn how to do this. And again, you can see it from this angle. The greater trochanter is usually somewhere about here. You can usually feel like a kind of a bony knob or protuberance. You want to kind of be above and posterior. And posterior in this case meaning down towards the mat. So I just know how to put my foot in and sort of scoop up. Doing okay there?
I'm smiling because I'm doing such a good job.
Or is it
with
just
cameras.
tender?
No, it wasn't anything. I was just like, boom, I got that shot. Camera 1 is where it's at.
And if they start to shift, move, I don't even worry about that. There's a reason we got these big nice mats. These are easy to clean off and wipe down after session. They're also highly functional. You can fold them up, just set them against a wall or put them in a closet. These are the ones I highly recommend to students because I just think they have the most pushback. They're soft, but they've got enough pushback where when you're doing a compression, you don't feel like the person's just sinking away into the mat. I'm going to reach a little further back this time. Not too much there?
No, it's good.
How's that on your back, by the way?
Feels great.
Good.
You feel it in my SI joint?
Now, on the outside, it looks like I'm just working on the leg. Also, I think this is one of those movements that people don't quite understand because if you've never had somebody do it to you, you don't know what it's supposed to feel like. And just adding some around the IT band there. Doing all right there?
Yeah, I'm good.
Your yoga pants, you're sliding away.
Okay. It's okay.
I'm gonna take Kristen's leg, and she thinks I'm stretching her, but I'm really dragging her back to center. How was that?
That's so therapeutic.
So, you want more of a twist this way?
That's nice.
Okay. So, even though my handle is here and I'm pulling the leg, what I'm really trying to do is lengthen all of those facet joints. And I know Kristen well enough to know that her SI joint is like an ongoing issue. And then, Kristen, if I were gonna take this, so I'm gonna add some stretch. What do you think about there?
That's nice.
Okay. Now, do you want me to go up this way?
No.
Or do you want me to go a little down?
Down.
Now when?
When?
Right there?
Yeah.
Okay. Now, if I give you a little bounce right here, how's that?
Nice.
That little clunk in your ankle, is that comfortable?
Yeah, it's fine.
Okay. And where do you mainly feel this?
Right here, middle of my back.
Yeah.
Right, SI joint.
Now, because she likes this pull and that little bit of bounce, I'm standing up. I'm trying to figure out how to do this with a little bit more oomph. So I'm going to come down and see if I can do this. I'm going to see if I can loop around her calf here to get some support. How's that?
That's nice.
Does this feel like it's not as beneficial as what I was doing
Is that
before?
way easier on you?
Yeah.
Oh, it feels great.
But I can hold this, and then if I hold and then rock from there, how's that?
That's great.
There we go. Now, I'm holding her leg. Is it too much where my knees are hitting you there?
No.
Okay. But I'm really trying to work on the lumbar spine. I'm really trying to open up those facet joints on one side. And what if I maintain right there?
Good.
I'm going to unwind just for a second, just to give that part of her spine a little bit more of a break. Then I'm going to bring her up. There's a little bit of a hamstring stretch, but I also want to explore sort of tucking the knees towards the chest to be able to change the position of the sacrum. So I'm going to do this one leg at a time. Like if I bring you up and over, do you want to go lateral or do you want to go more towards the...
Yeah, lateral.
A little more lateral?
So as,
This way?
I like that better.
Now, as far as pressure, if I put you in my holster right here, is it more like this?
Oh, yeah.
Okay. Now, do you prefer the rocking, sort of rocking in and out?
Yeah.
So again,
It's really tight.
it looks like I'm pressing just on the leg, right? I'm using the leg as a handle to mobilize the lumbar spine. This is where most of the work is coming from.
The hands just make it more intense.
Just gives a little bit of pressure into the adductors, a little bit of nuance.
Yeah.
But most of the pressure is delivered just from body weight. And what do you think? Hold right there?
Oh no, don't hold. It's too tight. You can't.
I'm down to right here. It's just giving her enough pressure to open that as she dies,
She dies.
slowly. Now, if I take your leg up and over now, and this one is the one I was kind of building up to. This is very beneficial for people. I'm just making a really big circle with the leg. So I'm going to give her a choice, okay? So I can bring her up, kind of knee to same shoulder, knee to opposite shoulder. Where do you want to go?
Knee the same. Ooh. If you do that whole twisty thing.
There?
No, I like opposite. I like.
Okay.
I like.
Up and over?
Yeah.
Okay. Now, if I'm going with the knee up towards this opposite shoulder, what happens if I go a little bit over? Is that more beneficial?
Yeah.
Okay. So I'm having to find out from her what works best, right? What I'm going to do is come up, and since I've determined that I can cross her over, I'm trying to make this as easy on my body as possible. So if I bring you up and over, do you need more up or more down?
Up.
Up till where?
There.
Okay. Now, because of my height, my leg is long enough that I can do this. When I bring you down and over, how far over do you want to go?
Oh, that's good.
Okay. Or do you mean to rock in and out?
In and out, it's always good.
Okay. In the Intro to Thigh Massage workbook, and this isn't an error, by the way, this is just like how the curriculum works out. I show knee to same shoulder, knee to opposite shoulder, because I thought it was clear. We're just mobilizing the hip to access the lumbar spine.
Yeah.
Guess what the students get fixated on?
Yeah.
Well, but like, how close to the shoulder do we go? And I'm like, well, it depends on their hip mobility. And they're like, oh, like they want it standardized.
Yeah, it can't be, but everybody's different.
But this is a modification of what's in the workbook.
Yeah.
And it's easier on my body. I'm able to rock in and out repeatedly, and I'm not straining my hands while I do it. How's that?
It's nice.
Right into there?
Mm-hmm.
Okay. You want some pressure in here?
Sure.
You want some pressure in here?
Sure.
Too much?
Nope.
Is it helping?
Sure.
Because now that I've got this leg over here stacked, I could actually drop this guy in and get some gluteal pressure if I want. How's that?
Nice. Whee.
What are we?
Oh, that feels so good.
Is it more the rocking on the gluteal or the movement of the leg?
Both of it.
Both of it. Okay. So, because of our time constraints, and I've only worked on one leg, I'm going to slowly unroll this guy and then traction her. How we doing on time?
You're doing great. It's a perfect time to switch at 7:17. You started about 2 minutes after, so you're kind of like right on time.
Still getting some length. It's just like doing a forward bend in yoga. You don't have to keep your legs straight. You can bend them and just straighten them as much as you comfortably can. So bring you up. And then a little bit over. Is that preferable?
Sure.
Okay. Feels good this way? Okay. And from here, I'm going to free up my hands so I can grab hold and give her a twist. And you like the rocking in and out?
Yeah.
Okay. In my case, just like before, I'm going to drop down. I'm going to see if I can get a hold right around the calf here, and that way I can protect the knee joint. How's that? Mm-hmm. Okay.
You should just let me rock the cameras. I was killing it. Thank you.
Just depends on what I'm doing,
I was
where I'm
killing
moving.
it, man. Let's see if things. Yeah.
If it feels better to you to do this from a standing position, do it from a standing position. Right there.
Oh, I see what happened. I was wondering where that one was over there.
There is no one up there right now. Whoop. Then, just like before, I'm going to let her bend. And is it a little more lateral like this? Because we're generally just bringing her hips through a range of motion. Now I've got it hooked in the opposite holster here. Most of the movement comes from hips. How's that?
Good.
Okay. Not too much in the adductors?
No.
Okay. %80 of the low back pain that I see in clients, I would address with a sequence that looks remarkably similar to this, depending on what they report to me.
Shiitake.
Too much?
It's tight. I need the yoga. Oh.
We gave her some lateral rotation, right? Now what happens when I bring her up, over, and across? Because I'm just bringing her hip through a range of motion to find out what she likes. If I go up and over, is it just like the other side,
That's
kind of
nice.
like in there?
Yeah.
Okay. So it's like free, free, free. Aww. The Amityville Horror, the Crypt Keeper. Once you sway the door and you feel like where it needs to be greased, that's where you're going to hang out, kind of over there.
Yeah.
So for her, it's not really knee just to opposite shoulder. It's a little further along. So when I bring her up and over, it makes it easy for me to step through and go, listen, right there?
Yeah.
Okay. Now is that too much?
No.
Because this is easy for me to do. Modifying things to make it fit your body is something you must absolutely do. A little further over. And then what do you think back there?
Oh, that's lovely.
What do we? Right there? Is it too much? Okay. Then I'm going to slowly unwind her again. And we've mobilized the pelvis. We've accessed all the lumbar spine, but how many times have I touched the low back?
No.
Exactly. But the client would get work like this, and then if they had a really bad low back problem, just achy sacrum, I would sometimes stop, like put them down for pressure right into the gluteals. Now in her case, because we work together all the time, this could be super nuanced. I could change this in myriad ways. Do you want me to go a little bit higher? A little more lateral?
Oh my God, all of it.
All of it, okay. So all the stuff around the gluteals is tight, all around the sacrum. What if I'm on top of the sacrum and like leaning down?
It's nice too.
Okay. But you kind of prefer the gluteals?
I like anything.
Anything. She just likes attention.
I do like attention.
She's like, take care of me. So this right leg is just planted. The left leg is just hanging out. It's soft ball pad of foot pressure just to rock this open. To me, in a sense, it almost feels novel, or not novel, like a novelty. Like, for me to think about what I do and how simple and easy it is to deliver, people are really surprised that I get such profound results for clients from using such simple techniques. But it was always trying to make it better for the client and better on my body, so it was easier to perform. You dying there, Kristen?
No, I'm going to heaven. I guess I'm dead.
And same as the other, it's kind of like all along the sacrum, all good
Yeah.
spots.
I'm tight ass. Apparently.
All these years of work, still tight ass. If I was going to use forearm elbows, I would use forearm and elbows after I had softened these structures using my feet. This is much easier on the giver, and then also I think it's easier for the receiver to take this on. If I then decided I wanted to come down and deliver some sort of elbow pressure, it's very easy for me to now come down, take an elbow and then put some pressure like along the sacrum, because it feels like I've softened the area with a bigger, broader tool. And now I can do a little spot like cleanup work. So if I hook right there and shear down or up?
Up.
Up. Tell me when.
When?
Right, okay. Now more to the midline or more lateral?
Midline.
More to the midline and still up?
Right in there.
There we go. The reason I ask those questions is because she's telling me where to put my elbow. It's almost like I'm grabbing, if I use the shirt as an example, I can grab a section of skin and then go, do you like this direction? Or, oh, right, oh. When she tells me that, I know I've gotten to that sweet spot, that spot that the massage therapist hits that you're like, oh, please just hang out right there. Now what about some rocking? Right there.
Oh, it's sharp.
Not too sharp.
It is sharp.
So I'm going to broaden it just a little bit. A little better?
Yeah.
There you go. And this, again, I would only use this after I had done that basic work to like get the process started. For lots of people, the lower back work that we showed just from working the gluteals that way is really going to open this whole area up and allow you to get some really, really great low back pain relief for the 70 to 80% of just generalized low back pain that we see in practice every day. And just coming back around just to soften either side. How you doing? You dead?
Yeah.
Mostly dead?
I could lay here all day.
Those sessions are only 3 hours.
That'd be nice.
And just to give her some balance for balance sake, I'll come back over to this side and see about the elbow along the sacrum there. And from there, is it leaning down or up? Okay, tell me when. Kind of there? And then what do you we think, more lateral, more medial?
Whatever, they're both good.
And then up?
Yeah.
There you go. If they don't have a preference between left or right, I just kind of go to the center. Right in there. And what if I give you some rock there now? Or is it better if it's static?
I like rocking.
What about this instead?
That's nice.
There you go. That's nice. So I could make all sorts of assumptions. And in the end, it's just so much easier when she's like, that's nice. That's what she wants. She's conveying and communicating to me that that is the pressure that she was looking for. Me, I'm just exploring movement and trying to make it as easy on my body as possible. But she tells me, that's it. That's the spot. That's the one I want right there.